when we talk about, like, in terms of physio, chiro, the relationship between the two professions in itself, there is a level of, as you mentioned, we already had a chat prior to this, the level of tension or the level of not understanding. And I think it flows both ways to an extent, in terms that, I have seen colleagues, when a patient mentions, oh, I went to see a chiro, and they're like, why did you go see a chiro? That's a very common thing, and I'll be honest. And even physios bash ourselves, but chiros, I've not met many people who are chiropractors, but the only two people I've met, which is yourself and Robert, are absolutely fine to myself. So I'm curious of that perspective from a chiropractor's side of it, because I know from physio wise, there's a good level of not understanding. I didn't even know that chiropractors could do certain things, could assess a patient from a medical standpoint, in terms of, like, a full understanding. I didn't know the depths of your understanding of anatomy. I thought it was just during the early stage, which is all you see is cracking backs, which I know is almost taboo. And I apologize for saying it, Catherine, but
it's fine. I think that's the whole point of some of these conversations, isn't it? Is for us to kind of almost recognize our misunderstandings and perhaps naivety to assuming that we know things. And so, yeah, hopefully we can kind of go through some of those facts today. But chiropractic's a regulated healthcare profession, has been since 1998, 99, the act was passed. And so to call yourself a chiropractor, you must have completed a 4 or 5 year master's degree. Within that degree, you're covering everything that you will cover in your physiotherapy degree in terms of anatomy, physiology, diagnostics, histopathology, nutrition, general diagnoses, understanding vitals and understanding how the body works, and understanding how to take someone's history, how to actually understand their health status. These are skills that are not exclusive to any one profession within healthcare. How a chiropractor takes your history will probably be exactly the same as how you would take someone's history as a physiotherapist, exactly the same way an orthopedic consultant will. We're asking all the same questions to understand someone's healthcare. The difference is what we do with that information may differ. Yeah. So if I've got a low back and leg pain patient walking into my clinic, I'm asking all the same questions that orthopedic consultant's asking. Exactly the same questions. Quite often I'd have done the initial, and if they end up with the orthopod, I've given them the history already. They may delve down into things. But where I'm then looking to use appropriate levels of hands-on care, rehabilitation, exercise, nutrition advice, CBT, whatever is needed within that package of care for the patient, the surgeon's looking at them with their toolkit open. Now, their toolkit involves different skill sets. If I feel that I've taken the history of this patient and that's actually what they need, their needs aren't fulfilled completely by my toolkit, I may co-manage with an orthopod, or I may manage that myself. And then, if things don't kind of go the way that we want them to, with conservative care that a chiropractor, physiotherapist, osteopath can provide, then much like yourself, I would refer that onto the appropriate healthcare provider. So in terms of our competencies and skill sets, it's to be a healthcare professional, be a healthcare provider with all the competencies and skills to know what that person needs and to know when I can provide it and when someone else may be best placed to.
Yeah, so that's an interesting thing that you mentioned, which I'd agree in terms of, I presume that, in terms of assessments, we're looking for similar questions of what the problem is and investigating the problem before you can start tracing anything. You have to understand the problem. And from what I can gather, to an extent, another core differentiating factor, or, even though what we would ask would be similar, and to an extent, some of our treatments would be similar. Example, you mentioned hands-on therapy. I presume, obviously, I think you guys do a bit more in terms of the hands-on therapy in certain aspects, because, we don't do, some people can do certain levels of manipulation, but in terms of university training, they teach you a little, and then most of it, you learn it by yourself. In terms if you want to go into more advanced, but it would be
education, like we all do,
yeah, further education. But in terms of exercise, let's talk about that one as well now, because obviously my own, every physio is very different. Some people, you have physios who don't really like exercise and like the old school ways of pure manual therapy. Some people, like myself, I move more on the exercise prescription and less on the manual therapy perspective. Where does chiropractic. Is it chiropractic? Yeah, where does that
We're
chiropractic? Yeah.
profession with chiropractors.
Yeah. Where on the spectrum is
The same
that?
way you are. Some of my colleagues will be very heavily focused on rehabilitation, getting people into the gym from day one. That's their bag. That's what they enjoy doing. All the way to people who don't do any of it at all. Just like within any profession, you'll have some people who specialize into certain areas.
Right.
And so their patient base in the private practice world, will then grow based on that. So within our clinic, we have sports therapists and sports rehabilitators. So we would tend to send a lot of that work to the sports rehabilitators because they do it every day and are fantastic at it. Much like you mentioned, physiotherapists don't do that much in terms of manipulation. Why would you want your neck manipulated by someone who does it every now and then? Why not have it done by the person who does it 100+ times a day, and is much more proficient in doing that? So you want people using the skill sets that they are most competent in. I sit very much in the middle as that sort of chiropractor. I'm what you call a sports chiro. I work within professional sport, but also in private practice. And during my time at both QPR and London Irish, I would be doing everything from hands-on assessing, triaging, performance reviewing the players in there. And then I'd be leading yoga and Pilates classes, a couple of times a week. I'd do yoga once a week, Pilates once a week with the players. That's a skill set I've gone and developed. But every chiropractor graduating now will have a huge background in exercise prescription and rehabilitation.
Okay.
I graduated 11 years ago. So, we were definitely doing it then. And I know that they're only doing more now. And the facilities at some of the universities are absolutely fantastic. And they're learning alongside physiotherapists and sports rehabilitators in many settings.
Yeah. So you see, that's the type of knowledge, the things that, to an extent I'm not exposed to because I don't meet many chiropractors at all. And Harvey, you mentioned, you tell me about how many of you actually exist in comparison to, how many physios exist. But do you find that a lot of some of patients, I've literally spoken to someone who's mentioned they've seen a chiropractor, but although I know you guys mostly are in the private practice setting, but people tend to gravitate towards, going to chiro for almost similarly. I think some people, it's almost a coin toss as who they go to. Is it a physio or a chiro? As either recommendations. For example, someone with back pain who I was talking to, they said they've been to a physio and they've also been to a chiropractor as well, and then they go back and forth between the both of them. Would you say that's a fair assessment in terms of people depending on the condition that they're going for? But let's take a case situation.
Chiropractic is predominantly, if you were to ask the general public, and we have, and the regulator has asked these questions before so that we can understand it. You ask the general public, what would you see a chiropractor for? It's back pain and neck pain. That's what we're very well known for. It's what we are, incredibly well experienced in as a profession, and have a lot of skills that we can offer in that realm. So that's okay. If that's what people know us for and they're coming to us for that, we're all incredibly busy with back and neck pain. There's a lot of it going around. Back pain's the leading cause of disability worldwide. So there's plenty of that to treat. But what will then often happen is, for example, I've had a spate of plantar fasciitis patients recently, and it's because I treated someone with one who had seen me probably for neck or back pain previously, mentioned their foot pain, so I've started treating it, used shockwave, used some rehab, all sorts of hands-on things to adjust their foot and ankle, and had a great result. Yes, this patient had tried other places and it hadn't worked, but we were able to use the shockwave really with great effect for them. So what did that patient do? He went and told everybody else at his tennis club that I'd fixed his plantar fasciitis. So now I'm seeing lots of foot and ankle things. So of course, people are going to know your profession for something. But what will also happen is word of mouth will also spread in terms of a condition you treat. Yeah. So another lady that I saw with, she's got osteoarthritic knees. We're not going to fully reverse that. You can get some moderate changes in osteoarthritis if you can normalize the way that person weight bears. But this patient's then gone and told all of her bridge club friends that I've been helping manage her arthritic knee pain. Yeah. So, you also get that word of mouth referral too.
Yeah. Word of mouth is very strong. We'll come over to treatment and choice of treatment in a second, but I wanted to get your thought because I think if anyone listening to this remembers the panel we had, and I think you mentioned some things about the trainings that physio go through, and I want to ask you again now. What is in your words, what do you see that, the training of the physiotherapist, like, what is your perception of that in terms of the 3 years we spend, and what do you think we learn? Because I'm curious to get what you think we learn within those 3 years.
So as I think I said on the panel, and I know we talked about before we started recording, is that I'm not the expert on telling anybody what a physiotherapist is. I can tell you all about chiropractic, but I've worked, in our clinic here in Bristol, we have 4 physiotherapists who were all slightly different. We have one physiotherapist who does injections and ultrasound scans and has done a lot of postgraduate work there. We have another who's a real foot and ankle specialist, and we have another 2 who are much more general. I'm privileged enough to be able to work at the level I do within the profession to understand how some of these things work. But, physiotherapists, the way I would tend to describe the difference in training is broad and kind of shallow, but not in a kind of that it's a low level, but it's across lots of areas. A 3-year program at bachelor's level to qualify as a physiotherapist, kind of where you can start using the title, and you're covering a huge breadth of things in small amounts. So as you've mentioned before, not so much of the hands-on that we would focus on in chiropractic. I'm sure some courses will do more hands-on than others. That's been my experience of talking with new graduate physiotherapists, is that some courses do more than others in hands-on, but that you've got a wide breadth of things so that you can then go on and do your 1 or 2 year specialty master's training or development within the NHS in the area that you choose to. So that's, for me, kind of my understanding where it starts. And then anything more specific than that, you'd have to ask a physio. But you compare that to chiropractic. And when I'm talking to students who are saying, should I do chiro, should I do physio? I always say it depends on where you visualize yourself at the end of your course. Chiropractic, I would say, rather than physiotherapy, which I would say is, that kind of block on its side, covering lots of different things in a kind of bite-sized amounts across a huge breadth of things that can go off and be specialized in. Chiropractic is stacked more narrowly. So chiropractic is stacked far more in the kind of areas of MSK, hands-on treatment, the sorts of things that are all about mechanics and biomechanics, the pathophysiology around that, the biopsychosocial model around that, and looking at managing someone's spine and their moving parts of their body an awful lot more. We do general diagnosis. We understand how to assess someone's health status, blood pressure, heart and lung sounds, abdominal exam, looking at fingernails for, checking for signs of, clubbing and edemas and all sorts of things. We do all of that general diagnosis, but then the treatment element of what we're learning to do won't focus so much on getting someone post-operatively back to their, normal gait, or kind of dealing with anything post-surgical across the breadth of things that physio would be involved in. We're looking at people from a much more functional and biomechanical point of view. And we do 4 or 5 years of study. So we graduate at a master's level straight off. You can't register as a chiropractor unless you have completed that master's level training. So we're, of course, going to spend longer training in a much more specialized area. So we are, as a profession, from day one, a little bit more specialized in what we do. But obviously, as a physiotherapist, chiropractors can go and add on to what they do there. So I've spent a lot of my postgraduate development focusing on sports. So I can do yoga and Pilates. I can teach that. I've done a lot of athletic taping. You'd cover a bit at college, but of course there's always, more and more you can add. But, I'm already on a trajectory. Some chiropractors will go off and specialize in pediatrics. Some will be in neurology. So they'll kind of develop their niche into those areas. But it's all starting from that standpoint of mechanical and kind of musculoskeletal specialists.
Okay. I'm quite happy you clarified, because I think even myself as well, when you were mentioning it prior then, because you didn't give enough time, I think also some people also thought that what you were trying to imply was that, I'll correct something that you mentioned as well, not correct, but add on to something. But I think people implied that you were meaning that, physios were not ready to go out of the box of uni and they needed more training before they were ready to go. So I think that was all people were, some people took.
Well, I mean, we can dig into that. It depends on in what you're speaking about. Yeah. Now, you're a new graduate physiotherapist, day one, you've done your bachelor's degree. you think you're as ready to manage someone in clinic as someone who has done 4 years of full-time education and a year's worth of clinic placement, which is specialized in seeing and treating musculoskeletal people? Or would it be fair to say that after 3 years, you then have the opportunity as a physiotherapist to get that experience within whichever setting it is? Most will go into the NHS. I know some go into sports teams and into private practice settings, but do you not think it's fair to say that if you're going to see someone for back pain, acute low back pain, would you rather see the person who's done at least a year's worth of clinic placement, doing lots of hours managing that after 5 years, or someone who's not been in that clinical setting yet?
So that's a very good question, because the answer to that would be, naturally, coming out of uni, we are going to eliminate the fact that maybe forget about someone who did a physio master's. We're going to take someone who's straight out of uni, 3 years bachelor's as their first degree, and they've done a whatever program they've done, wherever, and they're coming out day one. Do I feel like they would be able to immediately start seeing MSK patients? Absolutely, they would. But the question you're asking is, which one would I feel more comfortable with in terms of someone who's done a 5-year degree for an MSK injury?
Yeah, exactly. And, again, like, so take pediatrics, not my specialty at all. Would you rather see me on day one coming out of, uni, where it's not been my specialty? I've not pushed on my CPD that much for pediatrics at that point. Would you rather see me, or would you rather see the day one graduate who's done all their placements in the breastfeeding clinic and with the pediatrics team? It's about picking someone who's got the competencies at the point you're seeing them. Of course, new graduates need the space to be able to get that experience, and we all in our professions provide that. But it is, I would say, fair to say that, in terms of being ready to treat someone day one, I'm talking about the day you can start.
So the day you're legally allowed.
The opportunity to, the world's your oyster in terms of which area you want to go specialize in. And you've got that opportunity within physiotherapy. Chiropractic, you've got opportunities to specialize, but not in the breadth, say, that physiotherapy, because you're going at a 3-year point, we're already at a 5-year point, 4-year point at that point, in a much more specialized kind of education.
Yeah. So to answer that question, if I was a patient, and I think my answer, if I was a patient and if I was a physio, would be different, which is why I think some people got a bit like testy. So as a patient, I'll be honest, if I fully understand the role of chiropractor and I say, okay, you guys are a regulated body, you're able to do assessments medically, and this person has 5 years of experience in this specific niche of that MSK setting, I'll be honest, I'll take the chiropractor in terms of who I want to treat. If I have back pain and they have proven to me that they can get results of relieving back pain over a day one physio, because if day one physio, as you're right, has a wide range of areas you can go into, so many areas, and then it's over time, then they can pick whichever one. However, if from a physio perspective, I think why physios may get testy when you mention something like this is because the assumption is that some people believe that as soon as they come out the gate, they are supreme, and it is not. I'll be honest, it is not a. Yeah, it's not. I'll be honest. I've met physios who believe that they are supreme straight out the gate. They need development as well. Even myself, if you asked me straight out the gates when I first started, do I feel comfortable enough to do a basic assessment and provide basic level of treatment and keep someone safe and progress them. But if it gets complex, and that day one, I'm talking about when I first started, if the patient came in with, I don't know, a stenosis, lower back, severe stenosis, lower back pain, causing lower back pain, and then causing X, Y, and Z. As an MSK, I would not feel the greatest on my day one straight out of uni treating, because that would be a complex.
Yeah, and this is the thing. I think that people get really testy when you're challenging their position in the world. No new graduate is the best person to see. No. Is it? That's the point. And you used a really important word there, the word safe. New graduates are safe, and they are experienced enough to be able to assess and manage a patient safely. Yeah. This is why you have, say within the NHS, you have your hierarchy, you have your house officers, you have your consultants, your registrars, there's this hierarchy with experience for a reason. And that's a whole nother conversation, but that is the whole idea around mentorship and making sure that we're mentoring our new graduates. That's another conversation altogether. But what we talked about a little bit before we started recording was about this idea about assumptions about other professions. Now, like I said, I am not going to tell you what a physiotherapist isn't. I can give you some facts. I can tell you, at day one, that could be a 3-year graduate. That's a fact. I can tell you that a chiropractor is at least a 4-year graduate at day one, at least. So they're just facts. But what you can then do is start to look at, right, what are the competencies that come with that? Now, I've sat on many a panel in the past and been told with absolute certainty facts about my profession from physiotherapists, from occupational therapists, from rehabilitators, saying, well, you're not regulated. So how do we know that you're, that someone's going to check
what you
are regulated? And I don't mind people not knowing those things. I don't mind them not understanding everything about my profession. We are the smallest regulated healthcare profession. We are 0.5% of the whole of healthcare. So I understand not everyone's come across a chiropractor before, but don't then sit and proclaim things about a profession that you don't know.
So which is fair. Which is absolutely fair. I think, when, for example, making hard-coded facts, like, if you ask some physios, and again, I don't say this to be offensive, but I say this because some physios will listen to this, or maybe, and I'll ask, or some people, I'll have a chat with them and they'll tell me definitely that, they'll be like, oh yeah, chiros only do hands-on treatments. That is what they will tell me. And now I can come back and say, actually, hold on.
Yeah, and I'm sure they believe that. But what they've done is gone and probably spoken to one. And I don't think I have horns, and I don't think I have a but there are some fantastic chiropractors out there within your local community. Go and talk to a chiropractor. They would be more than willing to show you around their clinic, give you an idea of what they do. You can actually start to develop a really good business model with that chiropractor. You could look at, right, actually, I struggle to manage this type of patient. For example, something that we love treating, and I treat a lot of in clinic, neck pain, headaches. Love treating pain and headaches. Now, I know that there are the physios within my team that when they get a neck pain or a headache patient or a cervical radiculopathy, something like that, they're not as comfortable treating around the neck. That's this team. So in our clinic, we manage that. Where, if I've got a swollen knee, I can do some things to help manage that, but I might send that to one of my physio colleagues because I feel they've got the competency to handle it more. You may find that you get a lot of cross referrals if you start to work with the other professions. And, I can only speak for chiropractors, but chiropractors in your area. And they'll be more than willing. Or, have a look at our website, look at the British Chiropractic Association website. If you want to know a little bit more, we've got lots of information on there that people can kind of delve into.
Can digest. Yeah, no. It's very reasonable and understandable and fair to say. The physio in me, if you ask me, it's still, I think this is personal bias. I presume it might be variable to some extent, but you've also mentioned that, within a clinic, if you have multiple different individuals, you let the person who feels the most comfortable do X. Because me personally, if you ask me what is my area that I like a lot, it's neurological physiotherapy. I like neuro and I like a bit of respiratory as well. And I do MSK because it's the nature of my job. Am I an MSK specialist? Absolutely not. Am I I a rheumatology specialist like Jack? No, I'm not. Am I some guy, who you'd see for shoulder? If you have specific shoulder pain, I can treat you comfortably and I'll be happy to it. But at some point, I know where my limitations would end and say, actually,
knowing your limitations, again, really, really important point, because we all, no matter what your professional status and title is, we all just have to understand our professional limitations. So I'm not a pediatrics chiropractor, but I treat newborns, I treat babies, I treat children, I treat people through their pregnancy. But I'm always very clear with new parents when they bring their babies into me is, if I'm not sure what's going on, I'm going to send you to go and see Hugh or Rebecca, who are kind of the other side of town, who are really specialized in this area. I'm happy doing, a little check, and I can, if baby's healthy and happy and you want me to check something specific, I can do that. But if I'm not sure, I'm going to send you to someone who knows better. And sometimes they say, you know what, I'm just going to go straight to that specialist. I'm like, brilliant. That's absolutely fine. That makes me happy. You're happy. Baby's happy. That's all good. Sometimes they're like, oh, well, I know you, so I want to see you for a little bit. I'm like, okay, well, fine, we'll do our basics. And as long as we're all happy, then we can. But yeah, I know my limitation there. Whereas if someone comes into the clinic with an acute neck pain, I know full well the physios are sending them straight over to us.
Yeah, you feel more comfortable. So now that's a very interesting point you made. So I think even within physiotherapy, for example, some physios believe that they know everything. Some people fully well are aware of where their own specialty lies and stops. Even within a specialty like respiratory or MSK, there are people who, if you're an MSK specialist, you know there's some people in your team that know about the shoulder a lot more. So if you're having a really tricky patient, you'll go there. I think where some of the potential animosity or the reluctancy is across professions. So referring to another profession like chiropractic. But as we mentioned already, you can't do that if you don't know what they actually do. If you don't know what chiros do or what they can specialize in or what their things are, what they actually are more geared towards, you're not going to say, I feel comfortable sending someone across there, because you're going to have the old school mentality that all they do is X, when that's not all they do. So I think that's one key limiting. And I know if you have time, we might, 15 minutes after this, we'll talk about treatment choices, because that one, I think people will be asking me why we not talked about the treatment choices of both professions. But yeah, I think that understanding of what the other person does is going to limit why you can reference. Because I'll be honest, prior to meeting, Rob and yourself, if someone asked me, I saw a chiropractor and I said, fair enough, then I'm just going to carry on doing what I did. I would not think much of it, but I know individuals who they've heard chiro. Oh, why did you go to see the chiro? Why didn't you go see a physio first? And
that comes from a place of fear, and we do this, that comes across all parts of society. If you don't understand a culture, or you don't understand a way of life, or, say that it could be anything, it could be religious, it could be, anything, the shop you like to use, it's kind of, why do you do that? Well, unless you've gone and experienced it yourself and gone and understood it, you can't understand. And patients are on our preferences. We've got that we share within the clinic across, I've got patients. So yesterday I saw a patient for his, I'm managing more of the spinal stuff. So I'm seeing his neck and I'm treating his thoracics and, a bit around his shoulder, but he's having the rehab for that then with my physio colleague. So we're co-managing him. So he sees me for all the mechanics. Then he goes next door and sees Keith and he gives him his rehab because he's been rehabbing him through a labrum tech. So it's, we can co-manage these things, but we work together. So we understand each other's skill sets. We treat each other. That's a really important thing. Go and see another profession. I walked a marathon just over a week ago and my shin is still hurting. So, I've had Keith, give me some advice on that as well. But I've had Keith's a physio, but then I've had him working on the mechanics in my foot. So he's adjusted my foot and my knee and my ankle and my back, to make sure that I'm kind of functioning as well as I can. But Keith's got the ultrasound scanner, so he can tell me if I've actually ruptured my tibant, which he assures me I haven't. But how it feels right now.
Your pain begs to differ whether or not you actually have.
Right now, yeah.
But no, that's very interesting. And the thing which we'll hop on in a minute now which is, I think, another reluctancy. And again, I'm coming at this podcast or interview or whatever we want to call it, whatever chat, from I want to understand first. So I'm not here to fight, because I think some people will be saying, why are we not asking these? I'm trying to understand something in a greater depth.
On another occasion, if more come through.
Yeah, we can have another thing, but it's the choice of treatment. So hopefully we will close it here for now, and then we will come back to another one, and then we'll have a choice about choice of treatment, because I think that's another reluctancy for individuals.
Yeah, I'm very keen to talk about that. Yeah, let's do that.
All right, nice. I hope you enjoyed the podcast episode, but also make sure to subscribe to the Brooks Health Podcast on YouTube, as well as the podcast, so you don't miss another episode. But also follow us on social media at Brooks Health. Till the next video on the Brooks Health Podcast.